This is the Choices Community of Practice January Coffee Chat. We are so happy to have you all here with us today. It's our first coffee chat of 2023. My name is Molly Garrone. I'm a Senior Communications Coordinator for the Choices Project at the Prevention Research Center on Nutrition and Physical Activity at the Harvard T.H. Chan School of Public Health, and I'm pleased as always to be facilitating today's coffee chat. Our topic for today is engaging decision makers to advance healthy eating, physical activity, and health equity priorities. I would also like to take a moment to just acknowledge our funders who make this work possible, and also make a note that our Choices work and events are for research and educational purposes only. So today's event is intended to provide information, tools, and resources to inform and educate, and is not an attempt to influence any specific legislation. So for those who might be new to the Choices Community of Practice, I'll just briefly describe what it is. The Choices Community of Practice includes people whose work focuses on advancing obesity prevention, healthy eating, and active living, and want to learn more about how cost-effectiveness analysis can advance their efforts and address health equity. And it's our goal to support these efforts by providing tools, resources, and training opportunities. And our coffee chats are unique, informal opportunities to gather ideas, innovate together, and get to know each other better. So today we'll be discussing the many ways in which we can engage with decision makers to advance healthy eating, physical activity, and health equity priorities. Learning how to strategically communicate with decision makers can help support community actions and local health agencies' priorities to advance healthy eating, physical activity, and health equity. And we're really excited to be joined today by Oami Amarasingham, who is the Deputy Director of the Massachusetts Public Health Association. The Massachusetts Public Health Association is a nonprofit organization that promotes a healthy Massachusetts through advocacy, community organizing, and coalition building. Oami will be sharing tips and insights that she's learned from her experiences engaging decision makers that you might find useful for advancing your prevention priorities. Oami joined MPHA as the Deputy Director in January 2022, and before coming to MPHA, Oami served as Deputy Legislative Director for the American Civil Liberties Union of Massachusetts, where she led the organization's legislative work on criminal law reform. Prior to that, she was the Advocacy Director of the ACLU of Maine, where she worked to pass first-in-the-nation privacy laws, expand access to abortion care, and advance public health-centered drug policy. So welcome, Oami. Thank you so much for being part of our chat today.
Hi, everyone. It's so nice to be here.
Of course. So we hope that by the end of this chat, you'll be aware of strategies and tips for engaging with and educating decision makers about policies and programs that can make a difference in improving health and health equity, and that you'll have a chance to network with peers and learn from others about opportunities, challenges, and current resources to engage decision makers that may be useful in your work. So with that, I'm going to turn to you, Oami, and get us kind of started here with our sharing session. So I've got some kind of questions queued up here. So first off, I'm hoping that you could share a little bit more background with the group about the Massachusetts Public Health Association, and then maybe describe a little bit about who your decision makers are and how you engage with them.
Absolutely. Hi, everyone. Nice to be here with you all. Totally understand that people are doing many things and maybe not camera ready, but also would invite you to turn on your camera if you feel so inclined, so we can be a little conversational. As Molly said, my name is Oami Amarasingham. I'm the Deputy Director at the Massachusetts Public Health Association here in Boston, Mass. We are a statewide organization. We are a nonprofit advocacy organization, and we work to advance health equity in Massachusetts at the state level, often through the state legislature, but also working closely with the administration and local health departments and boards of health as well. Our focus is primarily on the social determinants of health and doing systems change work to create the conditions for people to live their healthiest lives in the communities that they live in. So we spend a lot of time working on healthy food access, housing stability, transportation access, to a lesser extent, healthcare access, but that is certainly a social determinant of health. But our bread and butter is really in housing, transportation, food access, and increasingly environmental justice, which is a new priority area for us. And so you can get, and one of actually the biggest things that we continue to work on, and those of you who are in Massachusetts today, I hope will know, is transforming our local public health system, which is very disparate. Massachusetts has the most public health departments of any state in the country. In its wisdom, Massachusetts has given every city and town its own public health department. We don't really have a county structure. And then there's a state department of health as well. But that means we have 351 separate public health departments, one for each town and city. And so we have been working, and those departments are not funded reliably by the state, and so mostly rely on municipal funding, and that has led to wide disparities in the kind of public health protections that you can expect depending on how big of a community you live in. So we have been working closely with many boards of health and public health leaders in Massachusetts to transform that system to be a more collaborative system and one that is better funded, so that no matter what zip code you live in, you can have access to the same basic public health protections. And I just popped in the chat our priority list for this, the next 2 to 4 years. We've had just had a change in the governor's office, so we have a new administration that is taking shape. And like all of you, wherever you are, our new legislative session has just started as well. So it's a moment of transition for us and for the whole state. And these are the priority areas and really principles that are going to ground our work for the next 2 years. And just to touch again on the kind of decision makers that we work with, as I said, we are a 501c3 and we don't have a lobbying arm. We don't have a C4. So we do some amount of lobbying work using our H election. That may be a familiar term or not, but I won't dwell on it unless folks have questions. But mostly we do public education. We work with administrative departments, the Department of Health, Health and Human Services in Massachusetts, and local decision makers and regional decision makers as well. I'd say beyond that, we also, healthcare is a huge institution in Massachusetts, a huge industry, really anchor institution for Boston. So we also spend a fair amount of time working with the healthcare system and hospital leaders to help try to get the hospitals of Massachusetts to look farther upstream in their own work, thinking about broader than patient health and population health, but community health. And rather than focusing on just health-related social needs, trying to point the hospital industry farther upstream to really the social determinants of health as a whole. So those are the kinds of decision makers that we as an organization spend most of our time working with. I personally am the sort of head lobbyist for our team. So I personally do spend a fair amount of time trying to lobby legislative leaders and elected leaders of other stripes in the state of Massachusetts.
Thanks, Omi. Thanks for sharing that background on your organization and the decision makers you typically engage with. And I think maybe you touched on kind of identifying your decision maker and the importance of that process. And I'm wondering if you could expand a little bit on that, and if there are resources or strategies to help people identify who the decision maker is and why that process is so important, particularly for determining how you'll communicate to them.
Yeah, absolutely. And I'm realizing I think I was also supposed to cue a poll to find out from all of you who's in the room what types of decision makers you work with, so that I can understand a little more and direct my comments in the right direction. I don't know, Molly, do we have that?
Yeah,
Oh, there it is.
fantastic.
Wow, impressive. So if folks want to check a box, or you have to, I think you have to pick one of the options, but feel free to also pop in the chat if you have any particular decision maker that you are gearing up to advocate towards. I would love to speak kind of directly to the questions that are on people's minds. So I think, often the key is, and it's not, sometimes it's easy and sometimes it's more complicated to figure out who actually has the power to change the thing that you want changed, or to make the decision that you want made. Sometimes, maybe often, there are multiple routes you could go. So in political work, certainly that's the case, where there may be great internal decision making, external, great, this is great to see. So it looks like most folks are working within their own organization to influence decision makers up the chain. Some folks using external decision makers. Oh, great, community and neighborhood leaders. That's a good spread. And community-based organizations. Great. So close this. So as I was saying, I think identifying who holds the power is really the first step, and there may be multiple people, there may be one, or there may be one person. In legislative and administrative work, there are often multiple people. There may be multiple agencies that have different roles to play. There may be legislation that's needed, or an ordinance that's needed, or a regulation that might be changed. You may have to go through a legislative or municipal process to get the policy that you want, or the change that you want, or the executive, whether that's the governor or the mayor or the CEO or the executive director of an organization, may have the power to make a decision on their own. And I think from there, also thinking about what does it look like after the decision is made. Implementation is often where the rubber meets the road, whether that's internally in an organization or externally in the political sphere or the public sphere. Once the decision is made, that's usually not the end of the inquiry. There needs to be implementation. There needs to be follow-up to make sure that the policy is working, or that any changes that need to happen can happen. And so that also requires often getting buy-in from other folks who are not maybe the last person who signs off on whether the decision is going to be made, but the people who are really going to be implementing, and whose work it's going to affect and whose lives it's going to affect. And so thinking not just about the decision maker, but how, after a decision is made, is this policy going to be successful, will probably depend on many other people. So I think it is generally helpful to get buy-in from not just the decision maker, but all those that will be impacted from the get-go. And so with that in mind, once you've identified the decision maker and other people who will be impacted and whose input and buy-in you will need, usually at MPHA, we go through sometimes a formal, but usually an informal exercise of power mapping. Are people familiar with that term, power mapping? Maybe like show of hands or thumbs up. Okay. Great. So power mapping, in short, is identifying who has the power, the decision maker, and then identifying who has influence over that person or that group of people. And somebody asked me a question, maybe somebody just accidentally came off mute. So identifying who has the power, and then identifying who has influence over the person or people who have the power. And then from there, figuring out your connection or degrees of separation, and best tactics to reach the influencers, people who have the influence, so that you can get to the decision maker. There may be several steps before you can actually influence the decision maker to make the decision that you want. Maybe it's a direct line. Maybe you are the #1 influencer of the person who has the power. But that's often not the case. But it usually, I think, you'll find if you go through this exercise that you probably have connections to people or groups that can become allies in your, I don't want to say fight, because it's probably not, hopefully it's not a fight that you're having, but in your quest, let's say, to get your decision maker to make the decision that you're looking for. And so often we in our office sit down as a team in the conference room and kind of make a web from person who we know is going to make, let's say it's one person for this exercise, who's going to have the ultimate power to say yes or no to our ask. And then from that center circle, try to do concentric circles of who will influence them, and then find our own connections to those people or those groups. So In Massachusetts, for example, the hospital industry is very powerful for many reasons, not the least of which is they are anchor institutions. They employ tons of people. They don't pay taxes, so they also have, but they have an enormous footprint, and so they take up an enormous amount of physical space in Boston and in Massachusetts as a whole. And so the word of the hospital industry is very powerful with the legislature and with decision makers of all stripes. And so, when we are trying to move our legislation to transform the public health system, it is really powerful for us to have hospital allies at the same time who join our cause and say, yes, this is important to us too, and this is good for hospitals, and especially controlling healthcare costs is a really powerful argument in Massachusetts and probably everywhere as healthcare costs get farther and farther out of control. On a smaller scale, in the office, I think probably many of you are, without thinking about it, doing your own power analysis of who holds power in the office, who is influential, who is not influential. I think also thinking about who the messenger is when you are having meetings and asking for decisions to be made is really important, and being clear-eyed about who is well-respected, who is trusted, versus maybe someone who is, for whatever reason, has less influence. And, I think demeanor also plays into this about whether the right kind of tactic to reach your decision maker, and that has a lot to do with interpersonal connections. So if you are doing internal decision makers, working within a structure, thinking also I think it's easy to figure out the hierarchy, who is the boss and who works for them. Maybe their deputy is somebody who is really influential. But also, sorry, I'm having a little bit of a Zoom issue. Okay. But also outside of that, thinking about social circles, or who gets along well, whose expertise is well respected. And often that really comes down to building trust. Who has already built the trust? Maybe the best course of action is for you to try to build trust over a period of time so that you become the trusted expert and the person that they're going to listen to. But if you need to get that decision more quickly, it's helpful to look around for who already has built that trust, who is aligned with us, and then start there, start meeting with that person. Is that person an ally? Can that person be on your side? Will that person independently reach out to sort of prime the pump with your decision maker, so that by the time you come into the office, they've already heard from a trusted source that this is a good idea, or this is an interesting idea that, decision makers should really pay attention to. Let me pause there and see if there are questions or thoughts in the chat, or Molly, if you want to drill down in a particular direction.
Sure. Thanks so much for sharing that, Omi. I really like that power mapping process, and I appreciate you kind of walking us through how that works. There are many leadership changes across states right now, and I'm wondering if you could speak to the opportunities and maybe also challenges that those changes present, and how folks could identify the appropriate timing to engage with decision makers.
Yeah, so Massachusetts is in this space right now. We've had a change in administration. I think in every state, in most states, the entire legislature gets reelected every 2 years. And then the House of Representatives also gets elected every 2 years. And even if you are not doing political work, the political cycle often leads to change in leadership across industries, because new people who are CEOs and in higher positions get tapped to go into new political administrations. And so there's a cascade effect that is certainly happening right now. The Massachusetts just appointed its new Secretary of Health and Human Services. She is a hospital CEO, so that will cause a bit of a shakeup in the hospital industry as well. And for us, this time of year is a really important time of year for us to get our priorities and our issues, and a really ripe time to do public education with the public, with the press, with decision makers and with coalition partners all at the same time. New year, everyone is looking at new priorities. It's certainly for us and in Massachusetts, a time of hope for what will come with all of the advocacy that we're doing. Those hopes, I'm sure, will start to get dashed at some point, but at this moment in time, it's sort of sky's the limit. Everyone is really in a process of visioning what we want to be doing in our organization, what the new administration wants to be doing with the state. And so I think paying attention to those kinds of seasons can also be helpful if you are ready to go with new materials, a new campaign. This in our state is a moment in time where people are very receptive to that. The docket is pretty clear. Everyone is building out their lists of what they want to accomplish in the next few years. So now is a very good time for us to say, hey, here's what we see as the top public health issues in Massachusetts. And moving forward, we want you to have our priorities on your list. That window does close at some point when things become hectic, when we're in the period of public hearings for political work, but even when groups are implementing their strategic plans, if you miss that window, it's not impossible to get back in, but I think it is easier at the front end when those plans are being made. It's also a moment when decision makers, organizations, elected leaders are trying to get a lay of the land. And I think that's a place where, particularly if you're doing public education work and not lobbying or advocacy, it's a really nice time to get your issues in front of folks and be very safe about that you're doing public education. Bills have not necessarily been filed or come out yet, so you're not lobbying on, there's no risk that you're lobbying on anything specific. And it's a moment where a lot of people in new positions are trying to get their feet under them and are looking to the experts, trying to figure out who the experts are so that they can have all the information in front of them. If you have white papers or fact sheets, written product, I find that this time of year is usually I will only speak to New England, a good time of year to put that kind of stuff in front of decision makers of all stripes. It's a moment when they are collecting information. It's a moment where you can be really helpful to staff, to decision makers. That is an excellent way to get your issues in front of whoever the decision maker is, by making it easy for whoever their chief of staff or deputy director, whoever that one person is who's going to brief them before they go into meetings. Making it very easy for that person to do their job is, I have always found that to be productive. So focusing on packaging your materials, your asks in multiple ways and sharing. I tend to, and this is another thing to learn about your decision maker and the person you're talking to. How do they want to receive information and how much information do they want to receive? I tend to err on the side of sending too much, but then also saying, I understand that you may not be able to read through all of this. I wanted you to have everything in case you do, but here's the high level 3 bullet points, the takeaway. Here's the shortcut. Here's the too long didn't read version of what I'm sending you, but also showing that I have a breadth of information. I have done my research. There is a 50-page white paper if you want to read it, but I have read it for you. And here are the highlights. To both establish yourself as a trusted resource and build a rapport, because presumably you will need more than one decision from this person at different points in time. And so to establish yourself as an expert and someone who has information, someone who's willing to do research if you don't have the information and help them get that information can be very helpful. In particular, if you are not doing, and if you are not allowed to do lobbying and advocacy, I think you are always allowed to respond to questions. So positioning yourself as someone who can answer questions so that the decision makers are asking you for your input and asking you questions when they are coming around to those issues is really important. It is a really important strategy for us.
Thanks, Omi, for speaking to those very timely opportunities for sure, and all those really great tips. That's fantastic. So thank you so much for that.